The field of palliative care is probably one of the most misunderstood subspecialties of medicine. It's a field that grew out of the need to mitigate suffering at the end of life. But the reality is it's so much more. It's truly symptom management at any stage of illness. And it's not limited to cancer alone. But the population that I happen to work with is those with cancer. It's maximizing a person's quality of life as they go through treatment for cancer, as well as life after cancer. And so the earlier that the supportive care team is involved in their care, the more time we have to establish that relationship over the course of a patient's illness. And this can mean any number of things. So having a dedicated team there for symptom management alone can really be an asset. And it's one more medical team that's involved with a patient. And so that initial decision on referring someone to a supportive care team for symptom management is between the oncologist and the patient. And there are some criteria out there to serve as guides for clinicians to make that decision. Up to this point, it's really been their clinical judgment. And so traditionally, when someone is referred to us, it's usually because they have several uncontrolled symptoms. Cancer pain is one of the most common ones, but there's considerable distress associated with that. And truly a complex symptom burden. And so a palliative care team takes care of the whole person. So we do a full assessment of all symptoms, even if the reason that you're referred was pain. And so it helps us understand the complexities of somebody's illness, and that helps us formulate the plan. And a big part of it are medications, but we also spend just as much time on the overall well-being of that patient. So the holistic component of the care is just as important as the pharmacologic component. So having palliative care involved early can really make a difference in multiple domains. And so there's high quality data to show that it improves quality of life. It improves the patient's sense of communication and relationship with the team. It saves money. It even improves overall survival. And so we have, there's enough compelling data to integrate palliative care early on. The ACCC hosts a webinar series that has an emphasis on older adults. And one of the 6 webinars that are part of that series focuses on early integration of supportive care. And it's an important topic because we spend the first part breaking down the most common myths that keep patients from accessing palliative care. And the second part, we talk about the multidisciplinary nature of palliative care. It's not just one person who's a palliative care clinician. It's a team that's taking care of that patient. And then we talk about what that means, what having that relationship with palliative care means when it comes to end-of-life planning. There's something to be said for having difficult conversations early on. And we as palliative care clinicians are extensively trained on how to have those conversations slowly and steadily. And so the webinar goes into some of the strategies that we use, both to engage palliative care teams as well as to have difficult conversations. A patient's symptom burden is very complex, even if it's not clear on the initial evaluation. And we know that from our consultations, when we're able to go a little bit deeper. There's always multiple facets to cancer pain, for example. And so acknowledging and placing value on personhood care, patient-centered care, means taking care of the whole person. There are so many stressors in a clinic environment, and it's completely understandable for one particular clinician, whether it's a primary care clinician or an oncologist, to be able to devote that type of time for a patient, in addition to all the time they're spending with disease management. And so the palliative care teams are here as partners, we're here as assets to work with the primary services and co-manage these patients. There's an open line of communication between the palliative care teams and the primary teams so that we're all in sync and we're working towards the same goal for the patient and their families. It's so important to have that open conversation, whether you're the patient or you're the clinician taking care of that patient, or you're the family member, or you're someone who just happens to come across this video, is recognize that palliative care, it's explore a little bit deeper into what it is. Ask the clinicians around you about palliative care and how they can improve your quality of life. Don't be afraid of it. And whatever you've heard about it, make sure to talk about it openly with your medical team so that they can share the information with you. Because this is a field of medicine that's there for quality of life, for the patient, for their families.